You're watching Mental Health with Marcie, and I'm Marcie. In today's video, we're going to talk about the side effects of psych meds. And so I'm talking about psychiatric medication and typically medicine traditionally for mental health conditions. And I've had a lot of experience with this topic. I have been on a lot of meds. I think I counted 11, and this is only in the last year and a half. It's not like I've been on psych meds my whole life and I've tried 11. It's like a lot of meds in a short amount of time. And so I have very acute experiences with side effects of psych meds, unfortunately. And everyone is different, right? Even if you take any kind of medication, even if it's not a psych med, there's going to be the potential for side effects. And I mean, you see those commercials on TV, they've got people walking around outside, chilling, fixing their car, whatever happy people stuff. And then they list in this monotone voice really quickly all the potential side effects. And of course, a lot of them are rare, but some of them are more common. And so the same thing with psych meds, in my experience anyway, I've experienced side effects with almost every psych med I've taken. Pretty much with every antidepressant, I've had bad side effects, but they do go away, at least in my experience. For some people, they don't. And so that's just a decision people have to make if, the benefit of the antidepressant is working enough that the side effect is tolerable. But of course, we can get into that later. But for me personally, I typically have headache, nausea, insomnia, and moodiness or irritability. And so those are the ones that I typically experience, and they really suck, as you can imagine. So you're already experiencing some sort of mental health condition that is either prompting you to start medication from scratch or switch your medicine. So you're already in a bad place. And then let's just introduce all these side effects. No, thank you. I'm already in a bad mood. Why you want to make me in a worse mood and physically nauseous? Because fun fact, I'm physically nauseous right now because I've added a new medicine just recently, and the side effects haven't gone away because it's been really recent. And so typically for me, they'll go away in about maybe 2 weeks or so, but it's just for one, you don't know if they're going to go away because everyone is different. You don't know if the medicine's even going to work, and it's you have to just endure them and just not sleep, have a headache, be nauseous all the time, be moody and irritable. It's aren't I just making it worse? Putting up with those side effects when you're already at a pretty low point really sucks. And so that's just, I've been reminded of super fun side effects. And I did a video on this maybe 6 months ago. Something like med changes are the little worst. So I will link that in the description down below if you want to learn more about what I said about med changes and how they suck. But they really do. And it's just the side effects. No, thank you. Especially the insomnia one. Then if you don't sleep well, then a lot of times you're not in a good mood, and then the moodiness and irritability. So it's how can you even tell if the meds are working, if the meds are making your mental health condition worse? You don't even know. And so it's so frustrating, and it's just, I guess, hard that I feel with a lot of other medicines, there's more of a not for sure, but a lot of times this is gonna work, this is your problem, here's your solution. But unfortunately with psych meds, it's just such a trial and error, and it's let's just try these. We have no idea if they're gonna work for you, and it's just so much more of an art than a science. And it's just really frustrating as the person experiencing it is trying to navigate it all. For one, you have to make sure that you're an advocate for yourself when you're dealing with a professional. Of course, I assume all mental health professionals, they want to help us, but they don't know, what's going on for you personally. You get however many minutes with them, but they see so many patients. And so I always try to advocate for myself. And, if I'm really sure, something needs to change, I need a med change, I'm going to make sure to voice that. And then the same thing, if it is working, or if you've heard bad things about other meds, like, feel free to ask questions. Like, you should ask questions. And, this is your health and mental health. And so you should be totally informed, and your mental health professional should help you along the journey. So feel free, and please do advocate for yourself. Another thing that I've found helpful in terms of side effects is really tracking them, so that you can go back when you have your psychiatrist appointment, or sooner if you need to reach out, and really document these side effects. Did they go away after a certain amount of time? Are you still having them? Like, how severe are they? How much are they impacting your quality of life? And so that's something to think about. I use an app, my mood tracking app, which I guess I made a video about that too. I'll link that below. I guess this is just a promo for my other videos. That's what that's turning into. But just kidding. But yeah, definitely tracking it in whatever, like a journal or an app or notes, whatever, can be helpful, just so like how, like what actually happened. And like, you're like, okay, well, I had a headache for 7 days, but now it's gone, or whatever. Like, oh my God, the nausea right now, like making this video, I just like want to throw up. I mean, I don't want to throw up because that sounds painful, but again, it's like, even just making a video, it's like impacting my life. It's like, and you want the meds to help you, but you have to like go through hell to get there. And then there's no guarantee that it's gonna even work. I think that's the worst part, is that it's like, you go through all this hell and you don't even know if it's gonna work. And it's like, that's what's, I think, the most frustrating. Because like, if it's like, okay, well, you have to deal with this for 2 weeks, but like, that at the end of it, you're going to be super happy or whatever, that would be great. But that is not always the case. Everyone, like I said, everyone responds differently to meds. Everyone has different varying levels of side effects. Some people have no side effects, which is great. I mean, I hate you, but I don't really hate you. Actually, I think that's wonderful, because I don't want anyone to suffer any kind of side effects, because it really is discouraging for people who want to try meds. Because I guess big whatever PSA here, I'm not trying to discourage anyone from trying medicine, because I do think that medicine can help people with mental health conditions, and there's lots of evidence showing that it does help. So please don't feel discouraged if you're like, oh, I was going to try meds, but like now I'm not sure because all these side effects. Please don't feel discouraged. If it makes sense for you and your conditions, speaking with your mental health professionals, feel free, to try different medicines, of course, with a doctor's purview. But it's just really frustrating when there's just no guarantees of results, and just the suffering of it all. It's like, haven't we suffered enough? And so, yeah, I'm just currently really frustrated with not feeling well, and like already in order to change my med. And then it's like, now I also feel like physically ill and also moody and irritable. Like, okay, like that's not helping. It's like making my mood worse. So that's just what I'm going through. So if you've ever experienced this, definitely know you're not alone. There's lots of people who experience side effects due to mental health meds. So if I give any suggestions, I really, like I said, would just really document what you're going through. Definitely advocate for yourself. If your mental health professional is like, oh, it's not that bad, but like to you the side effect is intolerable, like let them know, like, okay, you need to make a change or whatnot, because like I said, they don't know your exact experience. So I want to make sure that you do advocate for yourself if the side effects are not going away, or they're just not tolerable for your quality of life. And then lastly, do be patient to a certain extent. Like I said, a lot of the side effects will go away, but again, that doesn't mean that, you should just have to suffer through them. Definitely documenting them and speaking to your mental health professional care team is going to be the best way, because they're going to know, okay, is this going to go away soon? And then again, once you have the documentation, then you can like say, okay, this has been going on for 3 weeks, like, or like, this is not a side effect that I can tolerate. I need to make a change. So I do encourage you, like I said, to be very open with your mental health professionals. And I I do wish you all the best, and I hope you have no side effects. I really mean that because they are the absolute worst. So yeah, hope this was helpful, and thank you so much for watching, and stay well, my friends.